Music.
Hello, everyone. My name is Juliet Opoku. I'm a registered nurse, certified diabetes educator, and certified bariatric educator at Unison Health and Community Service in Toronto, and founder of Living a Balanced Life, Inc. Today, I've been privileged to speak to you about exercise. So how you can incorporate exercise into your daily routine to help improve your blood sugar, to prevent complications of diabetes, to help you live a balanced life. I know when we talk about exercise, usually a lot of people don't want to hear it because, part of the diabetes management that people frown upon, but it's a very important pillar of diabetes management. And diabetes management does not just involve just taking your medication, but it's a combination of all the good lifestyle management, which include eating a healthy, balanced diet, making sure you're controlling your stress to the best that you can, taking the medication, of course, as prescribed by your doctor, and of course, exercising, right? Because exercise is an important pillar, like I mentioned earlier. There's lots of reasons why you want to exercise and you want to incorporate that into your daily routine. Diabetes is a condition that has a genetic predisposition. So if a family member, like a mom or dad, a sister, a grandparents have it, it increases your risk. Doesn't mean you're going to get it, but it increases your risk. Exercise is one of those things that you can do that can help if you do have family history to help, either prevent yourself from getting type 2 diabetes or, delay the onset, right? Because we know that type 1 diabetes is autoimmune disease. Even though it has genetic predisposition, it's not the same as type 2 diabetes where lifestyle plays a huge role, right? So today we're going to talk about exercise. And when we talk about exercise, exercise has many, many, many benefits, as you may already know. So when you are exercising, you are improving your heart health, you are improving your lung health, you are improving your brain health, your physical health. It helps help you maintain your weight or help you lose weight for those that weight loss is their goal. It helps improve your bone strength, muscle strength. It helps with flexibility, so improve your range of motion. Exercise, once again, help with your mental health. When you're exercising, your body releases a lot of hormones that are anti-stress hormone that can help improve your overall mood, improve how you feel, make you feel much better. So when you exercise, you're not only getting the physical benefit from it, but you're also getting the mental health benefits, which means that your body's releasing dopamine, serotonin, epinephrine. These are all hormones that help stabilize your mood, help improve your mood, help with your cognitive health, and improve your memory. So exercise is very, very important, as I said earlier, because it's a pillar that should be incorporated into your routine. And so when we talk about exercise, what types of exercise should you be doing? Because sometimes when you're diagnosed with diabetes or when your doctor tells you that your blood sugar is getting there, when you have pre-diabetes, what should you do to help you improve, to manage diabetes or prevent diabetes? So there are types of exercise that we recommend, which is the aerobics exercise, resistant exercise, and then flexibility exercise. So these are the types of exercise that everybody, especially if you have diabetes, you should incorporate into your routine. So aerobics exercise is the type of exercise which strengthen your cardiovascular health, which is your heart health, and also your lungs. Right. So these type of exercise includes dancing, swimming, walking, biking, and mowing the lawn. So helps and is part of aerobics exercise. So this type of exercise, once again, helps improve your cardiovascular health. And we know that having diabetes in itself is a risk factor for cardiovascular health. So when you're doing the exercise, it's helping you prevent the complications that could be associated with that. Then you have resistant exercise, which resistant exercise, it's just like it says, it put resistance into your muscle. It helps with bone health, help you build bone density, makes your bones stronger, and it helps with muscle mass, help you build muscle mass. And when you do this, it helps improve your blood sugar level by reducing insulin resistance, right? So when you have diabetes, people get diabetes because either their body's not making enough insulin, they're not producing any insulin, or the insulin that their body makes doesn't work properly. So diabetes is an insulin problem. Resistant exercise is that strength building exercise, and it helps you improve your overall health. as well. Then you have flexibility exercise. So that's when you're stretching, making sure that you're improving your range of motion. So we're able to still continue to do all the things that we love to do in terms of movement, right? So exercise, in a nutshell, that's the benefit, right? So these are the type of exercise, but how much of it do you need in a day? It's very hard to kind of put your mind around how much exercise you should be getting if you're not timing yourself. So whenever you want going to exercise, I recommend that you start timing yourself. Because if you're like me, you start walking for like 10 minutes. And then if you're not timing yourself, you think you've walked for like half an hour. But really, it's only been 10 minutes, right? So because we have the target for exercise and the goal, we want to make sure that we are meeting that target, at least the minimum to start off and then increase as we build strength through the exercise. So in terms of aerobics exercise, the recommendation for it is about 150 minutes minimum per week. So that's the minimum amount you should be doing per week to help maintain your weight and to improve your blood sugar level and get all the benefits that I spoke about earlier with exercise, right? So if you broke it down to 150 minutes, if you broke it down to 7 days a week, that's walking for 20 minutes. 7 days a week will help you meet the minimum. Walking, let's say 30 minutes, 5 days a week will help you meet the minimum. Walking for 45 minutes, 3 times a week, help you meet the minimum of the aerobics exercise. And you don't want to go more than 2 days without doing any kind of physical activity, because it's better that way. Then you build strength and you're able to, like aches and pain. So it's better to keep the routine going. So don't go more than 2 days without doing any kind of exercise, right? So that's aerobics exercise. Then you have resistant exercise, like we talked about. So that the target is about 2 to 3 times per week you should be doing it. So of course, because it's resistant exercise, you're working your muscles. We want to make sure that you're not overdoing it where you're harming yourself or you're hurting yourself from the exercise. You need to give your body a break. You need to listen to your body. So 2 to 3 times a week you should be including resistant exercise. And resistant exercise is any exercise that you're working with weights or against your body weight, right? So doing things like push-ups, sit-ups, leg lifts, any exercise that you do that you're working against your body weight, help put resistance in your muscle, and it helps improve your overall health. Or you can use actual weights where, you either get resistant band, you can use that. You can use sandbags. You can use anything that you have lying around the house that's way more than a pound. You can use that to do some resistant exercise. So you can use can of soup, can of tomatoes, anything that you have in the house. Like I said, exercise shouldn't be so complicated that you have to go purchase a whole bunch of equipment, right? Resistant bands, you can get them from your if you have a diabetes educator and you visit them, most of the time they'll be able to get you a resistant band where you can use it for your exercise. Grab 2 bottles of water. You can use that as exercise while you're going for a walk. You have your water bottle that's help put in some resistance in your muscle. We're not asking you to become bodybuilders, so you don't have to go buy all these weights to do it, right? Anything you have lying around in the house that weighs more than a pound, once again, is good enough to start the resistant exercise, and make sure that you're doing it properly. Diabetes Canada has tons of information about resistant exercise and aerobics exercise, especially resistant exercise for the elderly. There's brochures on them that shows you the proper way of doing it. Because remember, with exercise, we want to make sure that we're safe. Everything we do, we want to make sure that we're safe. So when you're exercising, same rules apply. Listen to your body. You're exercising and you're getting really short of breath. You're having chest pain, feeling dizzy. All of that, you need to stop, listen to your body, speak to your healthcare provider, speak to your diabetes educator, speak to your, your endocrinologist, speak to your family doctor, any healthcare provider that you have, speak to them so they can ensure that you're safe. So there's stress tests that you can do, and stress test is the test that monitors how your heart can tolerate different types of exercise, right? And if you're going to take exercise more serious than vigorous walking, then I recommend that you speak to your doctor to make sure that you're safe. Because it's important to exercise, but it's important for you to be safe so you can continue to exercise and benefit from it. So safety is always number one. Listen to your body, and then get the help that you need to help you manage so you can prevent the complications of diabetes through your exercise program. So that's resistant exercise in a nutshell. So if you have no idea what to do, visit Diabetes Canada. The brochures are online. You can get it that way, look at it to help you manage, speak to your diabetes educator. They can physically get you a brochure that has all the tips, safety tips for you to start your exercise journey. And then we talked about flexibility exercise. So flexibility exercise, once again, you want to make sure that you are getting a good range of motion, like you're moving all your joints, be active, and it helps prevent complications that could be associated, because diabetes is a chronic illness, and most people that have diabetes have other comorbidities. They could have arthritis, they could have hypertension, high cholesterol. All those can cause you to have mobility issues or range of motion issues. So making sure you're stretching and doing those exercises helps you to prevent all of that, right? And to prevent complications that is associated with it. So very important: aerobics exercise, resistance exercise, flexibility exercise to help you get the benefit from head to toe. Because remember, diabetes affects you from head to toe. Because diabetes is a condition where you're not, like I said earlier, your body's not making enough insulin, and your blood sugar level is high, and the sugar is in your blood. Wherever blood flows through in your body, diabetes can affect it. So it's important for you to, when you're exercising, that you're thinking of the benefit that way, that when you exercise, you get the benefit from head to toe. At the end of the day, we're trying to prevent the complications of diabetes. We've talked about the target of exercise, but let's talk about safety. When you're exercising, you want to make sure that you're safe. So if you're someone that have never exercised, and now you watch this video and you realize that now you're going to start your exercising routine, speak to your healthcare provider about it, because let them know that now I want to take exercise a little bit more seriously. Tell them your plans so they can work with you to come up with a safety plan for you, right? Because remember, diabetes management, you're working with your team to help you manage your diabetes better. So it's not them telling you what to do, it's working in collaboration with your team to help you come up with a plan. So speak to them if you especially have hypertension, high cholesterol, or if in the past you've had stroke or had heart attack. You want to make sure that you're doing the exercise, but you're safe. So then they will send you, once again, like I said earlier, about stress tests, where they will test you to see how you're able to tolerate exercise in terms of your cardiovascular health, for you to be safe, because at the end of the day, we want you to be safe, right? So that's first of all. And then second of all, if you're exercising, for it to count towards your exercise goal, you have to be able to do the exercise at least in 10-minute block for it to count towards your exercise goal. Of course, every movement that you do counts and it helps, but towards your goal, it has to be in 10-minute block. So if you're someone that has mobility issues, sitting exercise and chair exercise also works. Once again, the information is also on Diabetes Canada if you want to get more information about chair exercises and what you can do to improve your overall health. So when you're doing those, make sure that you are connecting with your healthcare provider so they can tell you, if you have these comorbidities, how much weight you can lift, right? Because if you've had heart attack in the past or stroke, you want to make sure that you're safe. So then your healthcare providers can tell you, this is how much weight you should be doing for you to be safe. If you are taking medications such as insulin to manage your diabetes, and you're adding exercise as part of your routine, it's very important, once again, to speak to your healthcare team, because insulin's job is to help lower blood sugar. When you're exercising, exercise also help lower blood sugar, because you're using the sugar that's sitting in your blood as energy when you move, right? So now you have, you're eating healthy, you are taking your medication, and then you're exercising. All of this are working to help lower your blood sugar. So sometimes when you exercise, it can cause a low blood sugar, or what we call hypoglycemia. Hypoglycemia is when your blood sugar goes below 4 millimoles per liter, right? And usually when you have that, your body warns you, you have the symptoms. So whenever you're exercising and you're feeling well, you're feeling dizzy, you're feeling shaky, you're sweating, not because the exercise you're doing is so intense, but you're just kind of sweating for an unexplained reason. You feel very anxious. These are all signs of hypoglycemia. So whenever you feel different than your usual self when you're exercising, or even when you're not exercising, it's important for you to stop what you're doing and test your blood sugar. If you test your blood sugar and it confirms that it's low, which is less than 4, then you need to treat it. Right? It's a medical emergency. You need to treat it, because if you don't treat it, then the sugar can continue to drop. So when you're exercising and exercise become part of your routine, you have to make sure that you have these kind of treatment to manage your hypoglycemia on you when you're exercising. So if you're going for walks, make sure that you have your glucose tablet or Dex-4 close by you, like, in your pocket or in your purse or wherever you keep your supplies with you. So just in case your sugar drop, you have something on you. You can bring those boxes of juice, the small boxes of juice, that if your sugar drop, you have that you can take as well. You can also bring like lifesavers, to help you take it when your sugar drop, right? So always make sure that you have something on you that you can grab when you're exercising, so just in case your sugar drop. Or if you have diabetes in general, it's a good idea to have these on you just in case, right? If you are exercising and let's say you don't have your glucometer or the machine that you use to check your sugar with you, and you're having these symptoms, assume that your sugar is low and take it for safety reasons. But always, I recommend that you test before you take any treatment, because the symptoms of very high sugar and very low sugar can mimic each other, right? It's hard to tell. So if you can check your sugar, check. If you can't because you don't have your machine, assume it's low and treat it so you're safe. If you're taking medications such as insulin secretagogue, so these are the medication that causes your body to make more insulin. So those medications can also cause your blood sugar to drop. So once again, have something on you that you can grab to treat your hypoglycemia if it happens when you're exercising. Also bring snacks with you. So if you're someone that likes to join the gym and you're going to the gym or what have you, make sure that in your bag you have a snack with you. It could be a piece of fruit. It could be, like an energy bar. Pick the healthiest choice. Have it on you, plus your glucose tablet. So if your sugar were to drop, you can treat it, but then maintain it and sustain your blood sugar by having that snack with you, right? And having that snack, because then that way you're being safe, you're exercising and getting the benefit without harming yourself. So very, very important when you're exercising. Also make sure that you are in, comfortable clothes. Make sure you have proper shoes on, because diabetes foot care is very important. We want to prevent amputation. And when you have diabetes, because diabetes can cause nerve damages, where when you step on something sharp, you might not feel it. It can cause, you can have a cut that can lead to, a small cut that can lead to, get infected and can lead to bigger problems. So when you are exercising, you want to make sure that you're wearing proper shoes. If you don't know what type of shoes that you should get, speak to your healthcare providers. They'll refer you to see a chiropodist or chiropodist that can help you, tell you, their foot specialist that can tell you what shoes is proper for you and when you should be buying shoes and all of that, right? Give you the tips that you need. So safety is very important. Exercise is very important, but make sure that you're doing it safely so it benefits you, help you prevent complications of diabetes, and help you maintain a healthy, balanced life. Because at the end of the day, that's what we're trying to achieve, to help prevent complications of diabetes. So in a nutshell, that's what I have for you about exercise. Please try your best to incorporate exercise as a routine. Tips to help you get involved is, if you are a senior and you live close to CHC, like a community health center, visit there. They usually have programs for seniors, exercise program, weight loss program that you can join. There's tons of information on Diabetes Canada website that you can, look at and get information about healthy way of exercising and, tips to help you stay motivated. If you want to join the gym, by all means. You don't need to join the gym if you don't have to, because exercise, we want it to be part of your routine. So joining the gym, that necessarily doesn't mean that you're going to actually go, right? So make sure that you're making it part of your routine. For those of us that live, in Canada, where it gets cold during winter and you can't, go out and walk all the time because the weather is cold, try to come up with plans during winter months to help you continue with your routine. So if you're someone that goes to the gym, then you can do that. If you don't have the gym and you can go to the malls are usually open, they're warm, you can walk around there. Remember, time yourself, very important, to make sure that you're getting your, you're working towards your exercise goal, so you know how much that you're doing, right? To make sure you're meeting the minimum target of exercise. If it's not safe for you to go out there and walk, of course, once again, you have to be safe. Don't go when there's like snow outside where you can slip. If you live in a house or in an apartment building, you can walk within the hallways of the apartment building or walk within the house. Just make sure, once again, you're timing yourself. So you can say, I'm going to walk around for 10 minutes, you do your 10-minute walk. Or I'm going to walk around for 20 minutes, you do that. So that way you're counting that towards your exercise goal. If you can get out there when it's safe, always get out there, because change of scenery also help with mental, with mental stability, mental health, right? So if you feel like you're stuck in the house all the time, doing your exercise elsewhere can also help you. Change of scenery is very important for mental health. Diabetes can be an overwhelming disease to manage because everything that you do affects your blood sugar, right? When you're happy, when you're not sleeping, when you have stress in your life, all of that affects your blood sugar level. So it could be very mentally draining and stressful. So once again, be mindful, exercise help that piece. So exercise help you get the mental benefit, mental health benefit of exercise. So it helps you stay in control, helps you get the feel-good hormones that help stabilize your mood, improve your overall outlook on life, and it also improve your mental health, right? So very important. If you come a point where you become overwhelmed because of the challenges of diabetes or because of life, right? Because life happens, then always connect with your healthcare providers, your diabetes educators. They can help you with resources that can help you, keep you motivated for you to continue your exercising, healthy eating, stress management, and of course, taking your medication in combination to help you manage your diabetes well, to prevent complications so you can live a long life, live healthy, and enjoy the life that you've been given, right? So until next time, do your best to incorporate exercise. If you have any questions, once again, Diabetes Canada is a great place for you to visit to get all your information. When you're sourcing information, make sure that you're getting it from the right source, right? You don't want to just go anywhere to get the information because there's tons of information out there and not all of it is accurate. So you want to make sure that you're safe. So Diabetes Canada is a good place for you to go visit to get more information, research information that can help you with your diabetes management. So take care of yourself, enjoy your exercise, incorporate it into your routine. Think of exercise as a prescription, just like you take your medication, you won't need to do your exercise as well in combination to help you live a balanced life. So until next time, take care, and hopefully I'll see you next time in the next video.
Exclusive.